Welcome, I'm Jon Caldara, president of the Independence Institute and your devil's advocate. A little later in the program, we're going to talk about human trafficking, but now the modeling that brought us Obamacare and is, well, potentially bankrupting the state. So let's find out more about it. From the Independence Institute, Linda Gorman, our healthcare specialist, thank you for being here.
Oh, thank you.
All right. Now, this has always been your fun thing. You've been a big supporter of the idea of Obamacare right from the beginning. You knew it was going to be a success. You knew that every promise they made was going to come true, and it's worked.
I know. I could keep my doctor and my insurance plan and everything. I may be the only one in the state who has, because I have a grandfathered plan.
So when I see something as massive as Obamacare, they needed to sell it, all right? They needed something to say, this program works. It will work. They needed the intellectual ammunition to be able to con people into saying this was going to work, and it turned out to be a guy named Gruber. Who is Gruber? Who is this guy?
He's a very well-known professor at MIT who's done some really, really good work in economics. But economics isn't necessarily public policy. He was also a member of the Massachusetts Connector Board, which was the Romney Care trial balloon for Obamacare, if you will, in Massachusetts. So
this guy, he does economic modeling. Is it econometrics? Would that be the right way to call it?
He typically hasn't done modeling before. He'd done a lot of econometric studies. You take a data set, you see whether people take up health insurance or they don't. But apparently he thought that Obamacare was a really good idea, and he sort of is now known as one of the architects of Obamacare. And he went around the country saying he was one of the architects of Obamacare, and he said that he had a model that would show how many people would take up insurance in the state exchanges. And I think it was 16, 17 states, something in that order, hired him to model their states. And these are the states that set up exchanges, and Colorado was one of them.
All right, let's get back to the beginning, though. This is a guy who helped design the system, all right? So he helped put this together. He knew, how to put it, he knew that it was a chicken and egg problem. So let's just go ahead and make some assumptions that we really don't need to prove in order to make the model work. What is it that he assumed that didn't turn out to be true?
Well, we really don't know, because these models are typically proprietary.
Hang.
Consulting companies make money by selling their special models.
So wait,
it's like
hang
special
on.
sauce.
All right. So the most transparent administration in history decided that we're going to have a model where the model isn't even public. So you, an economist, cannot take a look at his econometrics or his secret formula?
Well, certainly we didn't in Colorado. We just hired him. Typically, the way this works is the models would be made public, but when you're hiring a firm to do it, not so much. This is fairly common. There are a lot of firms that run around with models for this and that. My only complaint is that you shouldn't use this for public policy, because you don't know whether it's a good model or a bad model until you've tested it against the real world and seen how its predictions actually work out.
These are companies that would be good if I'm coming up with a brand new line of pantyhose and I'm going to see if it's going to sell. I hire guys like this to test the market to do this. Mm-hmm. Yes, it says our costs will be less than what we think our revenues. Go for it. At which point you're risking private dollars who people who voluntarily have paid into this scheme.
Or pollsters. You know, how good was your poll in the last presidential election? If your poll was good, you get hired and you get lots of fame and money. If your poll was lousy, nobody talks to you ever again. You don't exactly say how you did the poll necessarily, but you're a pollster company. Well, that's what these modeling companies are like.
But Gruber did something different, though. After it passed, he went around and on many conversations, many public talks, said, yeah, I made this up in order to get it to pass. What exactly did he say?
Well, he didn't really say that about the model. He more or less said that about Obamacare in a lecture. Somebody caught him on tape, and he was saying, you know, we had to fool the American people to get this through, basically. And that was about Obamacare in general. And they did fool the American people to get this through.
One of the prime architects admitted that they had to fool the public in order to get it passed.
Yes.
Not a big surprise to any of us, but a big surprise that somebody pushing it would actually admit it. He's
yes.
obviously a professor, not a politician.
Right. He hadn't had a lot of public policy experience. I think that this is the more important thing, though, is that this is a lesson for future public policy. From my perspective, government should only be involved in things that are obviously things it should be involved in. And if you need some sort of esoteric model to predict that you're going to need a Colorado health exchange and that it's going to do this for Medicaid enrollment and this for subsidized insurance and that for premiums, then probably you shouldn't get involved because it's not really obvious that you should be involved. If you have to resort to models, there should be a big question mark floating over everybody's head.
Because when it comes
They
to government,
typically don't work.
Right.
You know?
That's the marketplace. We'll worry about that. And things in the marketplace that don't work don't last.
Don't go away.
Things that don't work in government get more money.
They're forever, yes.
Right.
Because we have to fix the problems that they cause.
And
that
it's a
costs money.
spiral.
Yes.
Right. Let's talk about what he did for Colorado. Why did Colorado hire the guy who said we need to fool the American public in order to get Obamacare?
Well, they didn't know that he had said that we have to fool the American public, right? Because at that time that tape hadn't been released. But he was one of the architects and he was selling this model to all these states. And what it did was it was used to argue that we should set up a health benefits exchange here in Colorado. Now, a lot of states, most states didn't set up one of these health benefits exchanges, but we did. And
We're
now
only of what, like 16 that did?
Yeah, not
Right.
the majority did not, because the federal government would come and do it for them, and they figured, why should they spend the money and get all this infrastructure? Our health benefits exchange is now over budget, has had a lot of problems with the board, and it's going to tax, I'm sorry, it's a fee.
A fee.
It's going to
It's
be
a fee.
applied to
It's a
each
fee.
one of our insurance policies so that we can fund this thing. And it's done.
So not only are people who are not buying Obamacare paying a tax, because that's what it was, a tax for not having it, so they're paying for it, but those of us who are getting insured are paying a fee above and beyond our premium in order to cover
Have this
the
exchange.
costs.
And all the exchange is
the
for-
exchange. This is
Yeah.
this is the market.
This is the exchange. Well, I
Right.
don't call it a market.
Right, it's
the
a buying
exchange.
place. Right.
And basically, we didn't need it, and it exists only to distribute subsidies. That's all it does. It doesn't sell people policies. It distributes subsidies that lets them buy a certain set of policies. You could do subsidies another way. You could have everybody buy an insurance policy, say they bought it on their tax return, and give everybody the same subsidy, and we wouldn't need exchanges, and we wouldn't need all these computer fails and everything else. There's much easier ways to do it. But they wanted to do it this way because it got a lot more people involved at the state level, more money distributed, so you have more support.
How off was he?
Quite
Now,
a bit, actually.
I mean, we Colorado taxpayers, forget national taxpayers, we here in Colorado hired the exact guy who said we needed to fool the public to basically fool us. What did he predict, and what was the reality?
Well, in reality, all these predictions are compared to what he predicted would happen in 2016. So all we know is our progress toward the 2016 predictions. Right now, Medicaid is already 40% over what they predicted it would be in 2016.
40%. So they were only off by 40%.
Yeah.
And it almost makes RTD's projections for fast tracks seem reasonable.
Right.
Yeah.
Although the VA hospital, you know,
good
makes
point.
it look good. But
That's true.
They predicted that about 6 times as many people would be buying unsubsidized insurance policies from the exchange. I don't really...
6 times as
Yeah,
many.
they're about a sixth of the projection right now, and I'm not quite sure why you would buy an unsubsidized policy from
if
the
you could.
exchange.
So wait a second. So he predicted 6 times as many people would buy an unsubsidized policy, even if they could get
At the exchange,
At the
yes.
exchange, even though the exchange is there to subsidize it.
Right, and
So-
you can go outside the exchange, obviously, and get policies that are different, have better networks and so forth. And then I think we're about a third of the way towards the prediction of people who would buy subsidized policies, and that's really rather surprising. You'd expect more people would be buying subsidized policies because remember, one of the reasons Obamacare was sold was people want insurance, but they can't get it or they can't afford it.
So, in other words, he was off on pretty much everything he predicted
Right.
for the Colorado exchange.
And premium increases.
Tell me.
They were supposed to go up not much at all, even though Obamacare put 27 taxes on your insurance premium. Best estimates that our insurance premiums in the state have gone up by about 37% for individual
37.
policies. He said about 19.
So he said it was going to go up 19%. Our cost for people who are just get a policy went up almost 40%.
Yeah,
Nice.
possibly more.
All
But
right. So, and we paid this guy to model this failure for us.
right. And so the lesson is, you know, be very careful with the models you pay for. And in fact, if they're trying to sell you a government policy with a model, you should think twice.
I'll remember that. What did we do before the state exchange? we had something called Cover Colorado, and I thought it worked pretty well. What was Cover Colorado?
These were the high-risk pools that were in 37 states, and they existed mostly to help people who lost their employer insurance but had developed a health condition so they couldn't get individual insurance.
In layman's term, this is somebody with a pre-existing condition, and I can't get insurance.
My employer
anywhere.
closes, my employer insurance goes away.
I got laid off, I
Right.
can't get any other, and I've got this condition, I can't get an individual policy because I have this condition.
Right.
So where am I going to go?
You go to Cover Colorado, which is the state high-risk pool, and their premiums were set at 137% of the lowest individual policy by the 5 biggest companies that were selling individual policies. So the rates were pretty good. And if you had an income under $40,000, they gave you a bigger subsidy.
So in other words, the idea of Obamacare was we've got to get coverage for people who can't get coverage, particularly people with a pre-existing condition. Colorado had a pretty interesting system, like many states, to help those people get real insurance coverage. Mm-hmm. It was more expensive because of their pre-existing condition, and it was also subsidized, wasn't it?
Yes, it was.
I mean, we paid more in our private policies. Mm-hmm. How did that work? Did it?
Pretty well. I mean, the Obamacare gap people would argue about is that they would say, well, the Cover Colorado premiums were too much for very low-income people, and that's why we needed the Medicaid expansion. But Cover Colorado worked well, and people who have been forced out of it into the exchange are not really happy if you talk to them, because one of the problems they have is that they don't have the network that Cover Colorado had. Cover Colorado, you could go to any provider in the state. The exchange plans typically have very narrow networks. Very limited choice.
See, because you said just two things that caught my mind. One is they said we need Obamacare because these people's costs are too high. Mm-hmm. That is, the premiums are too high.
Right.
It seems to me the logical argument then would have been if those premiums are too high, we could lower those premiums or give them a voucher or
give people money.
Give them
yes,
money.
It's not hard.
It's not hard. You give them cash.
Right.
Instead of socializing an entire country, you just give
people
them the cash so that they can pay their higher premium, but they're guaranteed acceptance, right? To a larger network.
Right.
But the smaller networks, so you can't go to the doctor you want, which is what I thought was promised. Rebecca Ryan was a story that Todd Shepard broke on Complete Colorado. Who is Rebecca Ryan?
She was someone who had health insurance through Cover Colorado. And when the state closed Cover Colorado, she had to go to the exchange. And she went to the exchange looking, she just wanted to keep the doctor she'd been seeing for 10 years. She had a complex medical condition, and this doc was familiar with it, and they got along really well, and she wanted to keep the doc. But they told her that in order to keep her physician, she was going to have to pay, I think it was 40% more to get the plan that had, the only plan that had her physician in it. So she would have had to pay 40% more than the 37% more she was already paying just to keep her doctor.
So she could just pay 70% more. There we go.
She could just forget insurance entirely and pay cash. I mean, you know, if you could afford it.
Linda, thank you so much. And remember, you're paying for it. Stay tuned.